counsellors here at Phuket Island Rehab, and today we're going to be talking about the effects of cocaine on the brain and the different withdrawal stages after you stop using cocaine. So the video is going to be split up into two sections. First we'll talk about the effects on the brain, and then the second portion of the video would be talking about the different withdrawal stages. Cocaine affects the brain in many different ways, but before we talk about the different ways that cocaine affects the brain, I wanted to talk about the common symptoms, and these include like insomnia, anxiety, agitation, decrease in appetite, weight loss, and hallucinations. And like different symptoms look different in everyone, so just be mindful of that. If a common symptom is apparent in one person, it might not be in another person. So it does depend on the individual. Now on to how cocaine affects the brain. So firstly, how does cocaine affect the brain? It affects the brain in like dopamine levels. So cocaine acts as like blocking the reuptake of the dopamine, a neurotransmitter that is associated to pleasure and reward. So by blocking this reuptake, cocaine increases the level of dopamine in the brain's reward pathway, leading to intense feelings of pleasure. Secondly, cocaine also affects the levels of other neurotransmitters such as serotonin and norepinephrine. Cocaine inhibits the reuptake of these neurotransmitters, so it contributes to its stimulating and mood-altering effects. Thirdly, cocaine also affects the brain structure and function, so prolonged cocaine use can lead to structural and functional changes in the brain. And an example of this could be altering the brain's reward system, and this can then lead to addiction and compulsive drug-seeking behaviors. Other regions that it could affect is like the decision-making region in the brain, impulse control, and emotional regulation. Cocaine use also affects and disrupts the brain's ability to adapt and change in response to experiences, a process which is also known as neuroplasticity. This can contribute to the development of tolerance, where increasing amounts of the drug are needed to achieve the desired effect, as well as dependence and addiction. Finally, cocaine also has cardiovascular and psychological effects. So for the cardiovascular effects, it could increase your heart rate, elevate your blood pressure, constriction of blood vessels. These in combination can lead to a higher chance of having a heart attack, a stroke, or other cardiovascular complications. And for the psychological effects, cocaine could affect our alertness, energy, and confidence. And it can also come with a combination of agitation, anxiety, paranoia, and hallucination, especially those who have been using it for a longer period of time or higher doses. Now to the withdrawal stages of once you stop using cocaine. This may look different for everyone, and it could depend on a variety of different factors such as the amount you've used, the duration you've used for, your physical health, and many other factors, but this is just the most common stages. So it starts with the withdrawal stages, which is 0 to 10 days. And some symptoms could be like nervousness, depression, and trouble sleeping. So during this period, individuals may experience physical discomfort and may require a physician close by to monitor their symptoms. This is why it is important to seek help when you need, so that you can do it in a safe environment, in a safe way, because your health is the #1 priority. The second stage is early abstinence, or the honeymoon phase, which is normally for 4 weeks after you stop using. And during this period, you can experience poor concentration, anxiety, and irregular sleep. So during this period, most individuals may feel good and may often feel like they're cured, hence the honeymoon phase, and they may want to just drop out at treatment. Therefore, this period can be a good opportunity to establish the foundation of your recovery journey and find your motivation to stay abstinent. For the third stage, it is the protracted abstinence stage, which is 6 weeks to 5 months after you stop using, and some individuals may feel mood disturbances, decreased motivations, as well as the other feelings from the other periods of the withdrawal stage. During this period, individuals may experience a variety of annoying and troublesome feeling, as this is normal because your brain is in its healing process. This period is called the wall, and it's important for individuals to be aware that these symptoms are a result of your brain chemical changes, and if they continue to remain abstinent, these symptoms will pass, so you just have to ride it out. Also, individuals may have a strong craving during this period and may have a high chance of relapsing or having a lapse, but as long as you stick it out, these symptoms will pass. And for the final stage is called the readjustment stage, and this is normally over 5 months since you've stopped using. And during this period, your brain has recovered substantially, but the main task now is for individuals to develop a fulfilling life with new skill sets that will help in promoting their recovery and staying on the right path of their recovery journey. During this stage, most of the difficult feelings may be over and individuals may experience less cravings. Still, you may need to work hard and remind yourself to remain abstinent and not put yourself in high-risk situations that will trigger you or may cause a relapse or a lapse. Yeah, and I just wanted to use this time now to reiterate that everyone's journey looks different, and you shouldn't compare your journeys to other people, and just compare yourself to the day before. And it is always okay to reach out and ask for help, as your health and your mental health is the #1 priority. And we're always here to help you, and if you need help in addiction recovery or mental health, underlying mental health issues, you can visit our website at Phuket Island Rehab, as we are always here to support and help you. Yeah. Thank you for watching.